So, welcome to the Global HR Community, a platform that brings together the HR professionals, people managers, business leaders, entrepreneurs, academicians, and students to promote excellence through people at the workplace, in the organization, at the individuals, and the society at large. Through our guiding principles, connect, learn, and grow. As part of the Global HR Community, we organize the Global HR Community Talk Show, Pathfinders. In this exciting segment, we spotlight individuals and organizations who are pioneering groundbreaking movements and initiatives within the workplace and the society. The Pathfinders celebrates those who challenge the status quo, inspire innovation, and drive meaningful change. Join us now to delve into the stories of visionaries who are not just shaping their organization but also making a significant impact on the world around them. Through the unique paths, we aim to uncover insights, share experiences, and ignite inspiration for a better, more inclusive future. Tune into Pathfinders and embark on a journey of discovery and transformation with us. On today's HR Talk Show, Pathfinders, we will be talking about the wellness warriors building a healthy workplace with Mr. Nandan Bhatia, the Director of Healthy Workplace Program at the Arogya World. Welcome, Nandan, to this show.
Thank you, Ramesh.
Nandan is a seasoned leader with over 25 years of corporate experience, specializing in health and wellness. He is passionate advocate for employee wellness, collaborating extensively at the Arogya World and within the NASSCOM Health Tech Community and esteemed industry bodies. Nandan's career includes impactful roles in renowned organizations such as Britannia Industries, HCL, Leela Palace, ITC Hotels, where he spearheaded high-value projects spanning administrative services, corporate real estate, and workplace management. Under his leadership, transformative initiatives in the workplace health, corporate wellness, and community engagement have flourished. Fostering sustainable work culture, Nandan's commitment to excellence and dedication to achieving UN Sustainable Development Goals have earned him prestigious accolades, including the Namma Bangalore Award, BCIC Award, and the Karnataka State Ratna Award. Noteworthy honors such as the Chairman's Club Award for spearheading India's largest R&D facility for Britannia further highlights his contribution. As a thought leader, Nandan prioritizes change management, social sustenance, and the formulation of healthy workplace policies, driving meaningful change and fostering a healthier, more sustainable workplace. We're indeed honored and privileged to have Nandan on our show today to talk about the wellness warriors at a health building a healthy workplace. Nandan, let me start by asking you to give us a brief introduction about Arogya World and how is it that you're promoting building a healthy workplace?
Thank you, Ramesh, for inviting me in the Global HR platform. And, I'm looking forward for this important discussion as a subject which is a need of the hour. I must congratulate the entire team of GHRC. You are doing a great work, and industry really needs thought leaders such as Shri, Nathan, and Ramesh like yours. And we are looking forward to learn more and more. Right. To introduce me, I associated with Arogya World, which is a global health nonprofit organization. We are working to prevent non-communicable diseases in India, and we strive to achieve our mission in terms of changing the course of chronic diseases, such as diabetes, cancer, heart diseases, through health education and lifestyle change. And our main focus is on partnerships with the government, with the industry bodies, right, and the corporates, and implementing innovative technology. And by implementing scalable sustainable programs, what we have currently offerings in the country, which are having a measurable impact, right, to make the difference towards the prevention of lifestyle diseases.
Great, Nandan. As you said, you talked about the non-communicable diseases. We realize that Arogya World has a strong emphasis on preventable measures for non-communicable diseases. So, how does the organization balance this preventive focus with addressing immediate health needs in the communities?
I think this is very important question, Ramesh, and you will agree that to address any issue, right, or a problem, we need to first understand the problem at a grassroots level, right, and then venture the solution which are easily adaptable to bring the consistent results. Now, to define here, the problem is the NCDs, which the world is grappling through, right? And as I mentioned, NCDs are also called as lifestyle diseases, uh, diabetes, cancer, and chronic lung diseases, which are among the top health and development challenges of the century, if you see. 2 out of 3 deaths in the world are due to the NCDs, with 80% of them in developing countries. And talking about India as a country, you'll see this is an alarming burden with respect to diabetes, where 100 million Indians are suffering from diabetes and another 120 plus million are pre-diabetic, which is certainly we can't live with it, right? And as per the government policies, India wants to certainly reduce disease burden by 25% in the year 2025. And that's what our approach is towards that. Now, what is the solution? We know the problem. Now, if you see, as per WHO, the solution lies in the prevention, which is the key. At all the core of our work, which we are currently working through our various programs, and I will talk about that also, is disease prevention through healthy living, right? And WHO also says that 80% of the heart diseases, 80% of the type 2 diabetes, and 40% of the cancer can actually be prevented by simple three process if we adopt these practices, which is avoiding tobacco, secondly, increasing physical activity, and thirdly is eating healthy foods. So these lifestyle changes, if you see, are what we promote at the community level. Today, again, to give you some more data, with half of India's 1.4 billion people having less than 25 years of age, we have to find ways to reach young people and teach them about the prevention. We are also, leveraging the mobile technology, reaching to the schools in terms of connecting with the adolescents and workplaces, which are very smart solution. And these are the platforms our programs are built on. So majorly, Ramesh, if you see, we are focusing more on promoting health literacy, where we empower individuals to make informed decisions about their health, is the key to create healthier India and make a great nation, right? And that's what the growth strategy today is being to be the number one in the world, right? So overall, Arogya World emphasis is to provide the framework which is based on preventive model, and that helps the organization, especially if I'm talking about the people where the 50% or rather 59.5 to 60% of the population in India is working in the organization to address its immediate health needs. So we help companies to create a guidelines on health risk assessment, risk-based surveillance, targeted intervention on better management of health. Hence, establishing a culture that promotes and encourages positive well-being is a need to grow the economy.
Very, very noble cause, I think you people have initiated. And as you rightly said, it's the need of the hour
Yeah.
and threatens, to um, put off people at different ages and also the society at large. You touched upon it about the use of mobile technology, and as India is now pioneering digital transformation, and Arya World is also known for innovative use of technologies. Can you share some specific examples of how you're leveraging technology to reach and engage with the large population effectively?
Sure, sure, Ramesh. Ramesh, this is, being understood now that uh, technology is certainly a game changer. Even in healthcare, technology plays an important role, and we are leveraging this mode to engage with the population level, because that's what we can make the change, or we can, make the difference. So we believe a multi-dimensional approach, which is needed to advance the fight against uh, non-communicable diseases. And I feel that it is yours and mine and the entire generation's responsibility to address NCDs to reach to population level. And here we are talking about creating a health champions and ambassadors at every level, right?
Right.
Who advocates the prevention program. So Arogya World is determined to use public-private partnership and smart technology to make measurable and significant public health impact, which we are talking about today. Therefore, we have developed a framework which is scientifically based, data driven, and outcome oriented to create the ecosystem of prevention, right? By integrating efforts being undertaken by various organizations and professionals in this domain. And as I mentioned, our mission is to build the healthy workplaces into a robust community, engaging more deeply with them, offering more program which is more on tech based, and services which is leveraging the entire data learning and artificial intelligence. And I would like to, talk about one of the most valuable programs in this endeavor. What we have launched is that recently we have introduced Arogya World's mobile-based diabetes prevention initiative.
Mhm.
Now, do you know that what is the percentage of the heart diseases or diabetes or cancer is there, and how it can be preventable, right? And as I mentioned earlier, that it's all about lifestyle changes which can
Right.
really create a big impact. Correct. Now, Arogya World's M Diabetes steps in as a groundbreaking nationwide public health initiative, Ramesh, where we are leveraging mobile technology to inspire positive changes in the diabetes risk behaviors. And we are
Right.
raising a lot of awareness about its cause and complications. So we need to understand that, right? So what we have done is we have developed in collaboration with the Emory University our program where delivers approximately 56 scientifically curated text messages over a period of 6 months, and we empower users to take control of their health and prevent diabetes. And by the way, this message is what we're using through a mobile technology is available in multiple languages, such as Kannada, Tamil, Telugu, Hindi, and so on and so forth. And it has seen a visible impact of at least 20% on behavioral change. See, Ramesh, it's all about nudging, right? If you keep
Right.
pressing on certain issue or you keep giving the solution, right? There will be a day when people will understand, yes, that it is now we need to implement. And I think COVID has taught us, right?
Right.
Where the health and well-being was given such an importance. And today, if you see, every individual is conscious about their wellness, right? We have seen how people whose immunity system was low, we have lost them during COVID, right? They were the first vulnerable lot, right? So, M diabetes, which we call it as, is the program, and its positive impact on the workforce has been, clearly visible. And as I mentioned, M diabetes is totally a mobile-based diabetes awareness and prevention program. And
Is
the
it
content of the program is very simple.
restricted only to the corporate world, or is it accessible to the society at
It is
large?
it is for the society, especially to the blue collar workforce. And we
Okay.
have started. We are talking to large organizations such as Tata, Reliance, right, Mercedes, and other, where you have the blue collar workforce at the shop floor level, right? So we are leveraging this mobile mode, because people today, what they cannot live without is a mobile phone, right, Ramesh?
Right. Is it a
right?
subscription model? Do
It
people have to pay for it, or is it how does it work,
No, so
Nandan?
it is certainly a subscription model, and today a lot of organizations are using consolidated message dissemination method through mobile phones, right? And we integrate into that, and we give them the content,
Okay,
right? Which is again comprises of lifestyle and medical information, right? Such as how to follow a healthy, balanced diet, or how to include regular physical activity in our lives, right? And as I said, it's all about rigorous impact assessment, which helps us, through this technology, by giving the messages remarkable at least 20% improvement in the health behaviors among the users. And through our collaborative efforts with the partner organization, obviously we can't do alone. So we are collaborating with the leading organization. We have been able to impact over 1.5 million individuals nationwide with this transformation program. And I
so
must tell
Nandan,
you, sorry,
sorry, go ahead, go ahead.
no, I must tell you, Ramesh, that this is also our pledge, which we have done during the Arogya City program, what we have launched, right? Where we said that Bangalore will be called as first Arogya City in the country, where a lot of stakeholders, organizations, government, associations are coming forward and taking a pledge towards taking the initiatives for betterment of health of citizens of Bangalore.
Right.
And this is being done along with BPAC, which is Bengaluru Political Action Committee, Rotary, and Ministry of Health and Family Welfare, Government of Karnataka.
So sure, Nandan, as you said that when you want to take this such a game-changing initiative globally or on a national basis, it requires a lot of policy changes. It requires a lot of private partnership, and as I said, we need some policy changes on the public health goals. So, what are some of the health policies that you've been able to influence the government or the organizations? And what are some of your success stories in these areas?
Sure, sure. I think it's a very important question, and I would like to state our work, what we are doing through our flagship Healthy Workplace program, right? And we have seen that our work in India is supporting public health goals and creating a big impact. We implement, as I mentioned, scalable diabetes prevention programs, educating and empowering people at a grassroots level, including the rural area, right? Working adults and adolescents as school children to take definitive steps towards leading healthier lives. And with our India-based programs, we are taking the first steps towards building a chronic disease prevention model for the developing world. And our programs are aligned with the WHO. In fact, our Healthy Workplace program framework is in guidelines of World Health Organization. Other interventions which we are doing currently in the country is aligned with the Sustainable Development Goal number 3 and Government of India's priorities such as Ayushman Bharat, Fit India, Eat Right campaign, and Poshan Abhiyan, right? And for this work, we have received a lot of accolades such
I
as
saw
UN
that.
Award, Digital Health Innovation Award 2023. And we believe that our work will help India meet SDG 3, which is good health and well-being. Uh, just quickly touch upon the healthy workplace, which is
Yeah,
our
that's my
flagship.
next question which I want to ask you.
Yeah.
You have instituted Arogya World India's 2023 Healthy Workplaces.
Mhm.
Can you share how you gone about assessing the healthy workplace?
Yeah, sure. So what we do, Ramesh, is we emphasize on data-driven solution as part of the business strategy through 5 steps process, which is assess, adapt, implement, measure, and improve, right? And you will agree that what can be measured can be improved, right? So our Arogya World framework, we have got an application which we help companies to come up with the important data points, to help them devise targeted intervention. By doing so, the companies are able to, have the analytics, especially data analytics around critical health related parameters, such as major issues currently in the workplaces. We have seen the tobacco use, employees who have difficulty in sleeping, or who are not exercising regularly, right? Or the employees who are not completing health risk assessments, right? So these are some of the critical issues, and based on which companies have adopted their employee wellness program to control the healthcare cost, or reducing number of sick leaves, or absenteeism, for enhancing employee health and productivity, right? So what we do is that we conduct the assessment as per WHO guideline. We give them an opportunity to talk about their current practices, right? And subsequently, we give them the industry benchmark report, which takes them to the next level. And we have, our tools and program, which is scientifically driven, data driven, and outcome oriented, right? Which makes a big impact to create a sustainable culture of health, right? In this way, companies are able to calculate their value on investments, or we call it as ROI, on the work what they are doing on well-being, right? And we have seen the results, which is to reduce healthcare cost uh, in terms of medical claims reduction, lower absenteeism, and other things, which other data which has been tracked by the companies.
That takes me to the next question, Nandan. Continuing from what you said, what are some of the most pressing challenges facing the workplace today in terms of employee wellness? And how do you think organizations can address these challenges effectively?
I will take you to the COVID to answer this question. And we have seen, from the employee database, the most pressing challenges facing workplace today in terms of employee wellness is that in today's fast-paced world, we often find ourselves caught up in the hustle and bustle of work, especially working in hybrid mode, Ramesh, right? That's a new normal, and
Right.
it continues, correct? So workforce are striving for endless productivity, but my question is, have we stopped considering the impact on our well-being? And according to WHO, it says the wealth of businesses depends on the health of its workers, right? Today, if you see, the workforce spends maximum time working, having sedentary lifestyle, demanding deliverables, mental stress, etc., which is actually affecting their physical health and mental health, which leads to the reduced productivity, if you see,
Right.
right? So hence, providing access to the mental health services and reducing stigma surrounding mental illness is again the a very important element from a leadership focused perspective. Uh, in fact, I must tell you that mental health is the next pandemic and should
Right.
be addressed effectively in respective organization. And this is actually clearly defined by Arogya World mental health criteria, which is being co-created with Emory University professors. So
Right.
there are two, levers, which is physical health and mental health. Our entire criteria runs around, right? And as per, to give you some more data, as per WHO again, an estimated 12 billion working days are lost every year to depression and
Right.
anxiety at a cost of US dollar 1 trillion per year in the lost productivity, Ramesh, right? And, to give you some more data, and I must highlight, and I think these are thought-provoking information which I'm talking about here, is that as per Asana, Gen Z experience the highest level of job-related emotional distress at 84%, followed by millennials at 74%. Even baby boomers are affected, with about half reporting similar feelings. So I feel it is our responsibility, and hence
Absolutely.
we must focus on these aspects to achieve WHO goals and in creating sustainable culture of health in the organizations, right?
Great, Nandan. To end this, the last question I would like to ask you is,
Sure.
as a thought leader in the health and wellness segment, what do you see as the future trends or emerging priorities in this field, and how do you plan to stay ahead of these trends?
I think, again, it's a very important question, and our endeavor is that. So, if you see in the evolving landscape of the modern workplace, prioritizing employee well-being as no-brainer. It has to become a cornerstone of organization success, right? Because you will again agree that healthier employees are happier, resilient, agile, and more productive, right? And as we navigate through 2024 and beyond, a holistic approach to wellness at work is imperative. So I feel, and I've seen that the organization are having a very progressive thought process, and their leaders are talking, and the subject is being discussed in the board meetings, and they have prioritized key components of a holistic well-being as a strategy, and which is emphasizing physical, mental, and social aspects to, create a thriving and resilient workforce. So they are having great practices around majorly on physical well-being, right? Where they're encouraging physical activity with on-site fitness classes or wellness challenges, right? Infrastructure creation in terms of ergonomic workspaces, health screenings and checks becoming a mandate, right, for the employees. Then comes the mental and emotional well-being I have touched upon, but I think it's very, very critical that you need to acknowledge the importance of mental health by offering designated mental health days or flexible time off for self-care, right? The companies are providing the EAPs, which gives a platform to the employees to have a confidential discussions or a counseling services, right? Mindful and stress management sessions is being conducted, and managing the stress to promote emotional well-being. So we are the custodian, and I think that's what when Arogya World does the entire healthy workplace program assessment and the report which we give and the intervention through tools and program. These are the major points which we focus upon and we nudge organizations to implement. Again, the social well-being is also very, very important to create an inclusive workplace culture, right? That values the diversity and promotes belongingness, right? Again, peer support networks where you can establish peer support networks on or mentorship programs to facilitate positive relationship among employees, right?
Right.
It's all about, how the leader is executing the program and how he is implementing the culture, right? And become the change maker in the organization, right? So these are some of the important points apart from, work life integration, which is currently considered in the hybrid work model. Even the financial well-being, conducting financial wellness programs
Right.
is also is an important, which we are, talking about, and we are leading the discussion forward. Recently, we have also spoke about climate change and health, Ramesh, as a catalyst 2030. You know how
Right.
climate change is affecting the health of the people, right? And it is not good to have, but must have to understand the pressing challenges of the correlation, right?
Right.
So it's all about, doing the brainstorming with respect to actionable ideas with the workplace leaders in terms of executing the, activities or initiatives which are more sustainable, right? And it is about igniting workplace to initiate collaborative actions for the change, right?
Absolutely.
Yeah, so these are some of the important pointers what we are currently, leading the discussion as a thought leader, and we have seen the big impact, especially in the workplace setups.
So great, Nandan. You touched on some very, very interesting and important points, especially in the end. You also talked about. I strongly believe that today we are all digitally connected, but I'm not very sure how many of us are emotionally connected, right? So emotional connection and emotional well-being is key for any
Right.
relationship or for a community.
True.
And I think a lot of emphasis is come post-COVID on physical wellness. We have gyms almost every street today, at least in this part of the world. I see that, but
True.
I hardly see any counselor or a psychiatrist or a psychologist in even in a town or a district. So I think we need to look at wellness holistically in terms of physical wellness, mental wellness, social wellness, or also add spiritual wellness.
True.
And I like what you also talked about financial wellness. Uh, And I think my father used to tell me this, health is wealth. So you may have tons of money in your bank, but if you don't have the health to enjoy it, money is of no use to you.
So true.
And not only become a burden to your oneself, but you become a burden to your family, burden to the community, and to the society, and to the governments. So I think with this note, Nandan, we would like to thank you very much. Thank Arogya World for the yeoman service that you're doing to bring about holistic wellness at the workplace and the community through your various initiatives and your mobile platforms. And we wish that you continue to spread this awareness and take it to not only across this country, but across the world. And thank you very much.
Thank you so much, Ramesh, for giving an opportunity to talk about a great project. Thank you.
Thank you.